my people, how have you been? I hope you have been enjoying your week. I have really missed you guys, but anyway, we have to continue with our classes. As usual, my name is Phyllis Oruguru, a nutritionist by profession, and I keep saying that all information that we share in this YouTube channel is based on scientific evidence. However, I try as much as possible to use simple language so that every subscriber, every viewer can get to understand what we are discussing, all to get the concept behind every scientific advice. Now, in our today's lesson, I want us to have a look at nutrition and renal management. Who is a renal patient? When you talk of renal patients, these are patients whose kidneys are not functioning well. It can either be one or it can be the two kidneys. But I want us to focus on the nutritional management of renal patients. And I want us to have 5 nutrients that you're going to look in detail. These nutrients include sodium, we also have potassium, we have phosphorus, we have protein, and we have fluids. Even to start with sodium, phosphorus, and potassium, these are minerals. They are micronutrients. They are naturally found in most foods, but for renal patients, we do advise them to minimize the amount of sodium, phosphorus, and potassium in their diet, and sometimes calcium. Remember, the fact that you're a renal patient, your requirement could differ from another renal patient, but these are just but basic nutrients which we advise the renal patient to monitor in their diet. So, despite the fact that you will minimize the foods which are rich in these nutrients, we also advise our patients to prepare their food in a manner that will reduce the amount of these minerals in their diet, because they naturally occur in foods. And the best method that you can use to prepare your food to ensure you minimize the sodium, potassium, and phosphorus is through blanching. When you talk of blanching, this is whereby you can dip your vegetables in boiling water or in hot water for a minute, then you remove. And since these minerals are water soluble, much of them will be left in the water, thus reducing the amount of mineral the patient will consume. We also know that when you consume a lot of sodium and the kidneys are not in a position to cleanse the blood, because that is the main role of the kidney, we know that sodium can result to high blood pressure. It also affects the edema. It's end up building lots of water in the body. We know that potassium is very important when it comes to the regulation of the heartbeat, and excess potassium can even result to heart attack. That's why the kidney plays a vital role in regulating the required amount of these minerals. Then when we talk of the fluids, how do you check your fluid? We normally encourage renal patient to reduce the amount of fluid they consume, because remember, the kidney is not functioning well, and the kidney is the one which is responsible in excreting or removing excess fluid from the body. Again, too much fluid will affect your electrolyte balance, will as well affect your blood pressure. Then we have the protein. For proteins, what we normally advise our renal patient is that eat quality protein, so that even though you consume less or very little, you still achieve the recommended dietary allowance of protein. So always ensure you eat quality protein so that you meet your requirement. So those are the main minerals that you need, or rather nutrients that you need to put into consideration as a renal patient. Again, we said we have sodium, we have potassium, we have phosphorus, in some cases we have calcium, we have protein, and we have fluid. Now you know. I hope you will practice this. If you know any renal patient, please advise them. And also, the other very important point for renal patient is their HP. They need to monitor their blood level. Hence, they should consume foods which will improve their HP or blood level. Now you know. I hope you have enjoyed this content, and if you'd like to continue learning more of nutrition basics, please subscribe to this YouTube channel. I have been your tutor, Phyllis Oruguru.